My name is Amanda Falk. Welcome. I am the Chief Clinical Officer at the Dorm, which is a treatment community for young adults ages 18 to 30. And as a multi-diagnostic treatment community, our clinicians often see young adults who are experiencing school anxiety and school refusal, which is why we are really thrilled to be able to collaborate today with Dr. Anthony Puliafico, who is the Associate Professor of Medical Psychology in the Division of Child and Adolescent Psychiatry at Columbia University Medical Center. He is also the Director of the Columbia University Clinic for Anxiety and Related Disorders in Westchester. He specializes in the assessment and cognitive behavioral treatment of anxiety, mood, and externalizing disorders. His research focuses on the treatment of pediatric obsessive compulsive disorder and the adaptation of cognitive behavioral interventions for young children. So with that said, I'm going to turn this presentation over. And again, please feel free throughout the presentation to be commenting, asking questions, and creating dialogue in the chat. We do want this to be as interactive as possible for our webinar.
Thank you so much, Amanda. And just want to give big thanks to the dorm and the team at the dorm for making this opportunity available. It's great to be able to provide these types of services, and I'm appreciative for everybody who's here today. Also, very grateful, we work collaboratively with the dorm in both our New York City and our Westchester offices. So always great to partner and collaborate. Looking forward to talking today about school-related anxiety and school avoidance. It's a big topic, and I know it's a lot to cover in 40 minutes, but I'm going to give an overview and really talk about interventions that we apply that relate to both students, caregivers, and school-based interventions that can hopefully be a nice resource and kind of launching pad for folks who are thinking about treating or currently treating high school students dealing with school-related anxiety or school avoidance. And then, as Amanda mentioned, we'll have time for questions later. As Amanda mentioned, I direct our anxiety clinic, which is in Westchester, New York, for those who aren't local, just right up above Manhattan, although we do have a Manhattan-based clinic. And we work very closely with kids, teens, young adults with anxiety and related concerns. And the presentation that we see quite frequently is school-related anxiety and kids and teens who are struggling to get to school or attend school or participate fully in school because of that anxiety. And one thing that we're always very mindful of is just how hard it is, to manage or support a student and a family with really acute school avoidance with just like a once a week or every other week session. So we're going to be talking about a pretty comprehensive set of interventions here. And we'll talk about how to think about applying those as we're moving forward. So just as we go through today, in terms of an agenda, we'll be talking about the overview. How do we define school avoidance? What are the functions of school avoidance that we see are most common and most typical? And then, like I said, we're really honing in on what are the interventions that could be most helpful for our high school students dealing with these concerns? How do we support caregivers dealing with students or children with school avoidance? And how can we partner with schools? Or if you're a school-based counselor, what are things that what are ideas to keep in mind to really support students with school avoidance? Let's talk about what is school avoidance. And this is, I'm sure, familiar to many of you, but really when we're using this term, school refusal is also a term that's been commonly used to talk about really the avoidance of school, primarily due to anxiety. And is often used for just like, kids who aren't going to school at all. However, I kind of like paint a broader picture with school avoidance. Yes, it's those kids who are just not going to school at all, but I also consider those kids who are maybe showing up in the building, but not being in class, whether they're spending a majority of the day in the nurse's office or in a guidance counselor's office, or sometimes high school students who are just finding ways to kind of be in the hallways or just in the bathrooms or just not where they need to be at school. or kids who are getting to school maybe fairly consistently, but following a real intense episode of anxiety or kind of pushing back at home. Kids who are getting there late or having a real hard time getting into the school building, or perhaps leaving early, or showing a lot of distress, or really begging to go home. So kids who are either not getting there at all or getting there, but with a whole lot of challenge. And the school avoidance presentation is actually, pretty prevalent. Like pre-pandemic, we were seeing rates of 2 to 5% of kids across school, so K through 12. I haven't seen specific data since COVID, but clinically, I would imagine that those numbers have increased. COVID and remote learning was one, a nice relief for a lot of our anxious students. But I think like the reemergence a couple of years ago, kind of getting back into the swing of things, of being in school and the school building, really, so not to mention educational losses, social losses that happened, during that period. And in terms of when do we see school avoidance peak, most often it's when kids are expected to start at a new school building or have like a new developmental level, right? So we see some school avoidance in our kindergartners. We see another kind of peak right around like middle school or junior high. And then for the area that we're talking about today, that jump from like 8th grade to 9th grade, or kind of a new high school building, we often see a bit of a jump as well. Really does correspond to kind of new schools or new stages. But we do see school avoidance really at every level, at every grade. Side note, we also see this in college, right? We see kids who get to college and then, aren't getting to classes, or aren't kind of meeting their demands in college. So it doesn't just go away if a kid graduates high school. But all the more important, I always say, to address this before a kid graduates high school, to address these concerns while there's the support of a school system, a family system, and all of us as clinicians there to help. Common presentations in high school. Let's think about like, what are the anxiety presentations we often see in our high schoolers, particularly those that lead to avoidance. Social anxiety is a biggie. We see a lot of high school students who are concerned about what others are thinking of them, of being judged, perhaps feeling slighted by peers, perhaps being concerned about teasing or bullying. So social anxiety is a big piece. And I will just say, with regards to bullying, we do have kids who are concerned about that. If bullying is occurring, I'm taking a different intervention. That's where I'm not expecting a child to kind of manage anxiety about that. That's really where we're kind of addressing the system and working with school and other folks to really reduce bullying. But really, in these other cases, it's how do we help a student manage their social anxiety around school? Perfectionistic worry is another big presentation we're seeing. Kids who are concerned about doing well enough, kids who are either avoiding their work or overdoing their work because they're so concerned about it not being done right. And we see a lot of these kids burn out and feel so kind of overwhelmed by the stress of school and the demands, or their perceived demands of school, that they just say, you know what, I can't do it anymore, or I can't go in today, or it's too much, or I didn't do my work well enough, so I can't face my teachers or face the building. Co-occurring medical illnesses or concerns about physical symptoms or medical symptoms is another big presentation we see when we're talking about school avoidance. These may be kids with diagnosed medical concerns. We see kids with diabetes or kids with Crohn's or other GI concerns who are very worried about how those medical problems may present themselves in school, or if they'll be safe in school. And we see other kids who are concerned about vomiting or having headaches or having other physical discomfort, which keeps them out of the school building. And then we see kids who are experiencing panic or physiological symptoms related to anxiety, which can often. So these are common presentations that we see, but really at the core of a lot of our school avoidant and school anxious high schoolers is this kind of trap of anxiety that I'm sure many of you are familiar with, but I just take 30 seconds to review this idea that when we experience anxiety, our instinct is to avoid, right? And avoidance works short term. So let's say you have a high school student who is scared about having a migraine at school. And let's say she's in her first period class and starts to feel a little sensation or something in her head. Her anxiety may increase, likely will increase. Her instinct may be to avoid, to go to the nurse, to go home. And if she does that, let's say she calls home and says, I can't do this, I feel a migraine coming on. When she does leave school, that anxiety is going to decrease. Avoidance works short term. It is a very powerful short-term reinforcer. So that anxiety goes down, avoidance is reinforced, works for that day. But the real challenge, as we know, is then the next day that child is in school and feels any type of physical sensation, whatever, that anxiety is going to come right back. And that child has learned that the only way to get rid of it is to avoid. And so this cycle continues. And that's our anxiety trap that we're really always trying to undo, in general, but particularly for our school avoidant kids. So the message that I'm sending to students when working with them, with parents, with school staff, is that anxiety is certainly unpleasant. I hate having it. I'm sure you all hate having it, but it's universal. We all have it, and it's not dangerous. What is problematic is the avoidance of anxiety-provoking situations. So we're really, throughout our interventions, promoting the idea of tolerating those feelings of anxiety, and minimizing avoidance, and that any efforts to kind of support students with school avoidance should really focus and center on building their ability to face those feared situations and setting expectations that they can do that gradually, meeting them there where they're at, but gradually building up, so that we really do break that trap. And when anxiety increases, we help teach a student how they can face a situation so that their anxiety may stay high, but they learn they can tolerate it. And they can learn that when they face their fear, that anxiety levels out, eventually goes down, and that facing fear is reinforced instead of avoidance. So that's really kind of at the core of all the interventions that we'll be talking about today. And there are many interventions that we'll be talking about today. And I say that because the way I think about school avoidance is it's really like 3 treatments in one. We are providing interventions to a student to provide, to give them skills to manage anxiety or whatever other concerns are coming up to help them get back to school. We are providing interventions to caregivers or the family system around a student to support them in supporting a student. And we're working very, very closely with school to perhaps change how school's responding to a kid, or to reinforce the things that are helping the kid to get there, and to think about what's making it most challenging for a kid to get to school. It's very hard to do this work in like a once weekly 45 or 50-minute session. Like I said before, you're not going to get very far, for a kid who's acutely avoiding school. And I bring this point up because I learned that the hard way as an early career or training psychologist. We really do need, whenever possible, a comprehensive upfront treatment plan that is allowing for, ideally a few different checkpoints a week for a student and a family, where a clinician or a clinical team can provide a whole lot of support to help meet a kid where they're at and help get them back to school. And the key in terms of figuring out how do I balance these interventions and which ones do I really focus on, how do I really kind of make this whole Venn diagram work, is really to think about like, what are the functions of this kid's avoidance? So for this kid who I'm trying to help get back to school, what's really driving their school avoidance? And that will really shape like how much we can emphasize each of these different spheres of intervention. So I'll show you exactly what I mean. A lot of work by Chris Carney, who's a school avoidance expert, and Anne-Marie Albano, who's here with us at Columbia and has also really done a lot of pioneering work in this area of school avoidance, identified 4 main functions of school avoidance. The first one being an avoidance of negative affect. So that's like this desire just to not feel bad, to not feel anxious or sad or physically uncomfortable. And that this not wanting to feel bad or miserable can help keep a kid out of school. It's a driver for school avoidance. The second one is avoidance of social evaluation, which we talked about before and can be very powerful. As we know, most teens have some healthy kind of social consciousness and conscientiousness and some low-level social evaluation. What we're talking about here is like the, where this social anxiety or fear of social evaluation is so strong that it gets in the way of kids kind of functioning or going to school. But the two other functions really kind of come from, results as school avoidance is at play. So one is attention-seeking behavior. What is the teen getting in terms of attention when they don't go to school? How are parents or how are family members responding when that teen's not getting out of bed in the morning? A lot of times those teens are getting attention, whether it be positive or negative, and that attention can be really reinforcing. We've worked with a lot of teens who family have a whole kind of morning ritual in which the teen won't get out of bed and a parent may go in the room, may try to kind of give a back massage or bring a cup of coffee or breakfast. That can be very reinforcing. And I know, the parents in these cases are always well-meaning and just trying to do whatever they can to kind of help. But the idea of getting all that attention for not getting out of bed just reinforces that behavior. And even if it's more negative attention that the teen is getting, what we know is that negative attention can be reinforcing. So that can also be a big driver of school avoidance. And then what are tangible rewards that a teen might get? Whether it's being able to stay home and play video games or just be on their phone or kind of be on TikTok or whatever's their like social media of choice these days. Or is it kind of going shopping with a parent or being able to watch TV or read a book they like? What are those other rewards that a kid gets for not going to school? And then there are other contributing factors that may very well also lead to school avoidance. History of trauma, for one, for sure, family stressors, medical problems. It's important to assess these different functions because then they're going to guide how do we shape our interventions. And this is what I mean. If you have a student who has a lot of fear of social evaluation, so the bigger the circle, the bigger the problem. There's a lot of social anxiety, and there's a lot of attention receiving. There's a lot of attention they're receiving for not going to school. If that teen's motivation is high and the caregiver has kind of high engagement in the process, it makes a lot of sense to focus on both like a child-based CBT, so we're doing cognitive behavioral therapy. We're really kind of going up front with those child-based interventions, as well as working collaboratively with caregivers on what they can do. Now that might shift if a kid's motivation is lower, and some of the functions are more kind of parent-driven, whether that's receiving attention or tangible rewards. In a presentation like that, I'm going to focus much more up front on how can we help the caregiver shape their behavior. Because I've got the caregiver's buy-in, and I'm going to get a lot further working with that caregiver on changing how they attend to these behaviors, and on how they reward going to school versus not. And I might focus less on giving the kid cognitive behavioral skills, at least up front, or until I think that they're ready and it will be helpful. And in cases where I really don't have motivation from a child or teen and caregiver engagement is low, those are cases where I'm maybe not kind of able to kind of move as quickly in terms of specific skills, but I'm thinking about building motivation and engagement. And I'm thinking about, is outpatient therapy actually the correct kind of level of support for this kid? Do they need a higher level program? Do they need an intensive outpatient program or something more intense in that moment? So in this way, and I know this is a broad overview, this is how we're really using functions to plan those interventions. Segue here and talk a little bit about what are those interventions that we help students or our teens with. I know these are little guys, but I just like this picture. It makes me laugh when it comes up. But, the approach for our students is very similar to the interventions that we will use for anxiety in both kids and adults. So what are those cognitive behavioral therapy treatment components? It's psychoeducation. We do a lot of clarifying values, which comes out of more of an acceptance and commitment therapy framework. We work a lot with how do we help our students be more flexible cognitively. And really at the core is graded exposure or an exposure-based intervention. How are we helping these students gradually face the situations that make them scared or that they avoid due to fear or discomfort. And I know 45 minutes is not a lot of time to go into kind of full detail with every one of these, but I'm just going to outline each of them, knowing that the skills themselves aren't necessarily unique to school avoidance, but it's the packaging and it's how do we put them together to help really address school avoidance in our students. So, when we're talking about psychoeducation, what I'm focusing on with the team is really just normalizing that feeling of anxiety. I'll talk about how I have it. We all have it. Anxiety is universal. We'll talk about anxiety sensitivity is kind of like a fire alarm. Like we all have hopefully smoke alarms or fire alarms in our homes. That fire alarm, thank goodness, will go off if there's a fire, but it's also going to go off if there's food burning or if there's a shower where there's a lot of steam. And the smoke alarm is going to sound the same way in all those instances. And for a half second, we're all going to think, oh my goodness, there's a fire. And before we realize, no, it's just Tony burning the chicken nuggets or whatever it is. Our anxiety systems go off the same way, whether it's true danger or whether it's just kind of being oversensitive, like that smoke alarm. And we help our students recognize like when their anxiety system might be going off for false alarms, when it might be oversensitive, and how can we respond differently there. And we do a lot of labeling terms, kind of calling out anxiety, externalizing it some, defining those terms. This way kids know what they're dealing with. They have names and labels for what we're talking about. So talk about why is attending school important for a student? We clarify those values. We want to think like, what is it about going to school that matters to you? A lot of people say, I don't care about school. I don't care about grades. But that kid might care about, being on their sports team, showing up for their varsity soccer team, or, an extracurricular club, or the idea of going to college might be important, or going to, being able to kind of have a high school diploma is important to a student. Or some kids just tap into a value of like being a honest person, or kind of like respecting their parents' wishes. So whatever those values are, we anchor the work in those. And we talk about like what makes it worth it to do the tough work we're talking about in terms of getting back to school, managing the anxiety and the fear related to school. Is it worth it so that you can see your friends and be a good friend? Is it worth it so that you can show up, for your team when they have a game next week? And really, using these as an anchor. And we also, in that same vein, kind of spend time looking at like, how can a student be thinking flexibly? We do focus on values in the way we talked about, like, how can we, how can you use your values to motivate you? We also we also help students learn how to respond to their fears with logic. And this is, for those who are familiar with like an Aaron Beck-based CBT approach or a more traditional CBT approach, really thinking like, what are the chances that your fear will happen? What's the worst that can happen? And we also apply, skills that are more related to like acceptance-based cognitive approaches, like cognitive diffusion or acceptance. And how can we help kids learn to accept certain thoughts or kind of separate themselves from their thoughts? Again, some of these ideas I could spend a full hour kind of talking about, but I just want to outline them and trust you all to, sorry, my phone is refusing to stop ringing. And so if you're unfamiliar with these terms, feel free to look into them, or I'm always happy to kind of follow up after the fact and kind of speak more to them. But I just want to kind of give an overlay of these are different cognitive approaches we're always taking with our school avoidance teams. And then really, like I said, at the core of what we're doing are exposure-based interventions. We're thinking frequently about how are we helping a student face their fears? How, knowing that avoidance of a feared situation maintains that anxiety over time, but the more a student exposes themselves to that feared school situation, few things happen. One is they habituate. They learn that like that fear over time goes away. If you think about it, think about like your first day at a new job where there's a lot of anxiety, and then think about your 100th day there. Or think about if you've seen a scary movie 10 times, the first time you might be jumping out of your seat, and by the 10th time, you're kind of bored. That habituation happens, and it happens for all of us when we're around scary things. A student also learns they can handle a situation, even if it's tough, like presenting in front of a class or, being called on and they don't know the answer. In their head, they might think, oh my goodness, that would be the end of the world. Yeah, it's embarrassing. Maybe their teacher's a little disappointed and they kind of move on and it all moves on. And that anxiety diminishes over time. So we really want to help our students learn to tolerate anxiety and learn that it's not dangerous. We'll use these graphics with students and actually our caregivers as well. This red line is just like what happens when kids do avoid. Anxiety goes up. They decide to kind of either not go to school or to leave school. Anxiety goes down. But then that's all that they learn. And this idea of avoidance is reinforced. With exposure, we're asking kids to kind of stay in that situation. Anxiety will often kind of go up a little higher. But eventually it peaks, and with time it goes down, which is what we know about fight or flight and anxiety. And eventually this is where we get, where with repeated practice, with repeated exposure, that peak anxiety is lower at each consequent time. So by the time you're getting to like a fifth or sixth exposure, you're not nearly as anxious. We talk about this and we use this to really kind of motivate kids, and kids do see it. We talk about ways they've seen it in their own lives, and we practice it together. Here are just common exposures that we do, for each of our kind of common presentations for school anxiety. I'm not going to go through every example, just for the sake of time, but, I'm happy to make the PDF of these slides available. And always happy to think through, hey, what are exposures that can help for a given kid in a given presentation? But these are just some that, we will often use and we employ when helping a kid manage school-based anxiety. We're also at the same time supporting caregivers, supporting parents, and thinking through what are the skills that we can really reinforce in caregivers and parents to help them support their student at home. But almost always where I start is listening, because a lot of times, if a kid has been dealing with school avoidance, if a family's been dealing with school avoidance for a while, the family's been through the ringer, and caregivers are often feeling exhausted, guilty about their kid not going to school, skeptical about treatment. We've been through this, we've been at this for years, what's going to change now? And oftentimes judged, or perceiving to be judged. And so, I always take the time, or try to always take the time, to listen and validate the caregiver's experience, so that we can kind of work from kind of a shared place of understanding about like what's been hard about this, where's the caregiver's motivation, and where are their where are they feeling skeptical, where are they feeling kind of like they've tried this already, and then that shapes which of the following skills I'll focus on most. So I'm just going to review like a few different approaches that I'm really employing with caregivers, and one is helping caregivers tolerate their own distress and tolerate their kids' distress. This is the whole idea of allowing ourselves to kind of feel anxious or uncomfortable and not trying to rid ourselves of those feelings. This is something that can be really helpful for, obviously, us as clinicians doing exposure-based work, being willing to kind of sit with distress, our own, am I pushing this kid too hard? Or, is this the right approach? Sitting with the kid's distress, being willing to kind of like sit in the room with the kid who's feeling uncomfortable. And we ask we let our caregivers know that their ability to kind of like hold their own distress and their kids' distress sends a message to their kids that it's okay to tolerate feelings of distress. And in fact, that it's important to tolerate distress instead of trying to learn how to get rid of it as quickly as possible. So this skill is usually key to the work that I'm doing with parents. Another skill that I employ a lot, and that's, I think, key to helping parents with school avoidance is an idea of coping model, which I always think about, and I learned this in graduate school and working with child anxiety. The idea of modeling for our kids that we all feel anxious and explaining how we handle it, that we're not perfect. This quote by Denzel Washington is great. Here's Denzel Washington, one of those decorated kind of actors of our time, talking about that, how he still gets nervous. And I think it's helpful for me as a therapist and for parents to be able to share with their kids when they're feeling anxious, or times when they feel anxious, of course, in appropriate ways, and to share both the times that we handled it the right way and maybe times we didn't. Maybe talk about how, I had a work meeting today and I had an idea, but I was feeling nervous about speaking up and I wished I had spoke up because I think it was a good idea. And next time I think I'm going to try harder. That normalizes that experience for a kid and helps build some understanding and alliance. So I employ this a lot, and I'd recommend this, keeping this in mind for our when working with parents. Another big skill in this work is consistency, particularly when working with families where there's two parents or caregivers. Making sure that the same message is being sent to a kid from mom or dad, or mom and mom, dad and grandma, whoever the caregivers are in the system. With this work, expectations and the interventions change rapidly, sometimes day to day, based on how much a kid is getting to school, what's going on the school front. So it's important for caregivers to stay on the same page. What I'll often say is it's great for a kid if they have multiple caregivers with different styles, but let's have the message be the same so that, it's clear and it's a united front and it's not confusing for a kid. That final skill that I'd emphasize here is reducing accommodation. And by accommodation, I know that, in school, we talk about accommodations, a very different thing, like formal supports. Here, we're talking about accommodation as like accommodation of avoidance. And what I mean by that is like, are there ways in which a caregiver knowingly or unknowingly kind of helps a kid escape a feared situation or prevents a kid from learning that they can tolerate anxious thoughts and feelings? So an example might be an unsubtle example would be that parent who allows their kid to stay home if they're feeling anxious. But a more subtle example might be a parent who's texting with their kids throughout the school day and, allowing for that lifeline to be there. And they might feel that it's a helpful support, but really what that kid is learning is that, I can't handle this on my own. I need to be texting my mom or dad throughout the day and knowing that they can pick me up at a moment's notice. So we want to think about all the ways in which caregivers might be accommodating that avoidance and really trying to minimize those to really help a kid learn that they can handle whatever feelings come up on their own while we're supporting a kid, of course. And I will always try to have like a very clear written out plan for behavioral agreement that is generated with parents and caregivers, really outlining like what's expected of a kid in terms of attendance. What are the privileges they can earn for going to school? I think it's important to reward kids for going to school. A lot of parents will say, why should I reward a kid for going? That's their job as a kid. And, there's validity to that. And at the same time, for that kid in that moment, going to school is really, really hard. And we all need kind of reward and reinforcement for doing things that are really hard, and sidebar, we all love our jobs and we also kind of get paid for doing our jobs. And, I love what I do. I probably would stop coming if, I was told I wasn't going to get paid anymore. So thinking about how do we reinforce our kids for doing hard things, but then also what are the very clear plans if a kid is staying home? What privileges will be removed? What will home look like? And trying to make home as unreinforcing as possible when a kid isn't going to school. In almost all cases, I don't like for this to be a negotiation with the kid because that can usually devolve into a whole lot of fighting and not a lot of productive conversation. So I usually like parents to kind of come up with this plan and present it to a kid. If I have a kid who's real motivated and engaged and able to like participate in this process in a meaningful way, I may think differently about it. And I just included an example here. Again, I'm not going to walk through the entire example for the sake of time, but I included it here as a resource for you all. And again, can share the PDF slides here, but just to be as clear as possible about how to lay this out for a kid if they're having trouble getting to school. And I, try to have a plan like this in place for anytime I'm working with a teen with school avoidance. Here's just a couple books that I do recommend for caregivers. These aren't school avoidance specific, but they are anxiety specific, and they could be really helpful. And then finally, in our last few minutes, I'd love to talk about what are school-based interventions? How do I, as a clinician, interact with school? How do I encourage families and parents and students to interact with schools to really help them get to school. Number one for me is identifying who's that point person at school. Who is the quarterback? And here, I'm a New York Jets fan. Chad Pennington's one of my favorite players, so he gets the photo here. But really what I mean is, like, who's that person? It may be a guidance counselor, it may be a social worker, it may be a homeroom teacher. But who's that person who can meet regularly with the student and communicate expectations, who can provide support and updates to caregivers and the treatment team, and who can really keep in the high school setting all teachers and other staff members informed and updated. So they're really the point person. They're at the center of the school-based approach. And it's just so important for me as an outside clinician to identify that person and have a real good relationship with them. And I am sending them, literally and figuratively sometimes, chocolates, flowers, what have you, because that relationship is real important. And they're usually kind of such big helps in terms of, helping a kid get back to school, both in terms of, implementing strategies that we're suggesting, and also to provide information on what school's seeing for a kid, which is a real valuable perspective. I also like to recommend, this is an idea that a colleague of mine, Jonathan Dalton, shared with me that I think is so helpful. And so I credit him for this. But just having what he calls like a step for success meeting, where it's like essentially a roundtable meeting that has all of the shareholders. So caregivers, treatment team, school staff, the child and the teen, if the child or teen is willing to attend, early on in the process, to really develop shared expectations and understanding of where's a kid at, what's hard about going to school, and what goals and expectations can we set for class participation, attendance, homework, accommodations. I've had teens show up for these meetings, real kind of like anxious, oftentimes socially anxious teens who show up and do a really beautiful job advocating for themselves and explaining to their teachers, school is hard for me because I'm very concerned about doing well enough, or I'm very concerned about, peer interactions. And that's why it's hard for me to show up. I want to be here every day, and A, B, or C gets in the way. And so this is what I'm willing to do. And I'm hoping we can all work together. And that could be a really powerful message to hear from the student. Because a lot of times teachers aren't sure what's going on for a student, why they're not there, what's getting in the way. So I always try to set this up whenever I can. With Zoom being here, it's a lot easier to kind of get everybody around the virtual roundtable for this type of meeting. And then I think whenever possible, it's important for all of these parties to stay consistent about when a student will be getting to school, how a student will be getting to school, what participation will look like. A lot of times we're kind of getting this kid back to school gradually. Maybe it's like a few periods during week one. Maybe then we're adding a period a day every 3 days. Maybe the plan is that kid's going to go back to school, but they're not going to do gym at first because gym is a high anxiety moment for them. And that's the thing that's keeping them out of school. Maybe they're going to show up, they're having a really, really hard time with OCD symptoms in the morning. So they're going to show up for second or third period. And we're going to try to have that be earlier and earlier, day by day or week by week. It's so important for everybody to be on the same page about what the plan is, so that the kid feels supported and so that there's no miscommunication. This plan changes a lot. So that's what I mean by it's hard to do this work just like once a week and have weekly touch points, particularly with this acute work. It's so important to either have a team or be able to kind of be available, if not daily, then at least a few times a week to follow up and adjust the plan. And a lot of times it can be helpful to have some accommodations at school. And we were just talking about a few of them. Although I want to be really, really mindful about school-based supports and accommodations, I only want to put in accommodations if they're in the service of more consistent school attendance. So if that accommodation is going to help a kid get to school or stay at school, or if it's a temporary measure to kind of manage anxiety. If a kid's going to for example, not go to gym or lunch or a tough class, because, taking that class off the table helps them to show up for the rest of the day, and not as a permanent removal, but much more temporary. So for example, we have a lot of kids who benefit from what we call an anytime pass, where their teachers are told, hey, Johnny's allowed to leave the room if he needs to for a period of 5 minutes, just to kind of like catch his breath, go to the bathroom, take a break. A lot of kids feel just relieved knowing they have that opportunity, and it helps them get back into the building. And then we work with them to gradually minimize how many of those they use. Although I'll tell you, many kids who have that anytime pass don't even use it. It's just knowing they can use it that helps them. We talked about kind of giving kids an excused temporary absence from a tough class. Every once in a while, I can get on board with like extending overdue work, if it's done appropriately, and if it's really in the service of helping a kid get back to school. If a kid has a mountain of work due and they're afraid they have to get it all done before showing up in the building, I think it's completely appropriate to say, hey, let's forgive all the busy work, or let's give you another month or two to get it done. Just show up. Don't worry about your homework. Don't worry about participating. Just show up, sit in the back of the room. That's what's most important. What I don't like is kind of giving too much of an extension to kids, because so many of our anxious kids avoid and procrastinate, and it only kind of maintains anxiety when they have work due with an indefinite deadline. There are other accommodations that I'm mindful of not using or really trying to avoid, because they might actually maintain anxiety. Home-based instruction is one that I see a lot, and in a lot of cases I get concerned about. This is, if a kid is getting instruction at home, so they're doing the academics, but the challenge is they're not really expected to kind of meet the demands of being a person, of kind of like getting up, getting out of your pajamas, like showing up at school, facing people, facing the world. Some kids, for medical reasons or because their symptoms are so severe, may need a temporary home-based instruction, but I try to be as judicious about that as possible. I also really try to avoid any type of communication with parents while at school, to really send the message that kids have a wide array of supports available to them at school, assuming that school is in a supportive place. And sometimes like texting can just be this like lifeline that prevents kids from feeling like they can get support at school. So I really try to work with parents to cut that out in these cases. And then we talked about this before, but really not giving not forgiving too much in terms of marking periods. I think sometimes, like particularly for high schoolers, there's a balance between not forgiving too many classes, because then you're giving a kid the sense that they can avoid and there's not really consequences to avoid. We see these kids too often kind of pass through classes even though they're not really doing the work, graduate, and then get into college and show up at college and really have no skills whatsoever to manage the demands of school. So I really want kids to learn, ideally before high school, but if they haven't yet, learn in high school how to fail and how to deal with like the natural consequences of not getting work done, knowing that, in high school, things matter more. It's on your transcript. And so there's a balance of kind of forgiveness, but also making sure kids are learning that there are consequences to doing their work. And that's really kind of like the art of doing this work, is how to balance the two. But these are accommodations that I do try to avoid. I know we're right around the 15-minute mark or so. And I know this was a lot of information. I did want to kind of make sure we covered it, because all of these pieces for me are really important in terms of supporting students with school avoidance. That said, we'll make the slides available as a PDF. This is our information. Be in touch if I could be of help, or if you're local and our services could be of help. Always happy to follow up. So looking forward to Q&A for the final portion of our meeting today, and I will keep this up in the meantime. Thank you all.
Thank you so much. We have a lot of activity in the chat and the Q&A, so I'm going to get right to it so that we can get to as much as is possible in these last minutes. So one question that came in is asking, are we to assume these students, meaning students that you work with, have been diagnostically tested to rule out learning disabilities related to processing weaknesses, which may have gone undetected and are in fact the basis of triggered anxiety?
Yeah, it's a great question and a great point to bring up. And when I'm doing a fuller workshop, that's absolutely something that I'm bringing up, is that so many of our kids with school-based anxiety or school avoidance have either diagnosed or undiagnosed learning challenges. And so one of my recommendations to families up front is to look into neuropsychological testing, either through your school or through, whatever outlet, to really try to make sure that there's not like a learning disability or a learning challenge that hasn't been identified. And if there is an identified learning disability, is it being appropriately supported in the school setting, and how is that being addressed? So I'm grateful that you brought that question up, and it's certainly something that I'm always thinking about with these cases, and I encourage folks to keep in mind with any school-related anxiety.
Great. Would you say that at the beginning of developing a plan, you focus more on the root of the anxiety than the school work? I seem to battle with the schools about this all of the time.
Yeah, it's another great question. And thank you all for being so active in terms of asking questions and bringing points up in the chat. I guess it depends on how we're defining that root anxiety, right? Like, I am very focused on helping a teen understand what anxiety is and how their anxiety manifests. I'm not necessarily going to spend a lot of time focusing on trying to figure out exactly why that anxiety came about. Partly because a lot of times that's hard for a teen, and also because I'm not sure how necessary that is. And again, I'm coming from a cognitive behavioral perspective with this. So I am much more thinking about, what's going to help a teen manage their anxiety, feel better about themselves, and start getting back to a place where they can kind of return to school. Now, that might mean they're not going to be doing their work right away. That might mean that, the first part of the plan is just get in the building or just sit in the library, even if you're not going to class, depending on what, the function of their fear is. But, we're pretty quickly moving to like some type of action towards approaching the school situation versus avoiding. But like I said before, in terms of the root, if we're talking about like what's the function of that anxiety, I am spending a good amount of time there early on, starting with like my initial assessment. What's really driving that fear and avoidance, and how do we put interventions in place to address that?
Awesome. Thank you. I'm going to skip around a little bit. There's a question that came in. This is, I've definitely come across this. I'm sure you have as well. Any suggestions for helping a student who can't, and I'm going to add a word, or won't identify any value in attending school?
Yeah, this is a frequent problem, and you asked this question. That's the kid. If we go back to those slides before, where we're thinking about what are the interventions that work, I am either spending time, in a slower way, kind of building motivation or gauging, are there any motivators for this kid? But for kids like that, I am also pivoting pretty quickly to those caregiver-based interventions. How can we work with the caregiver to make sure they're reinforcing school attendance as much as possible, that being at home is as unreinforcing as possible? And how can I work with school to make sure that they're helping a student feel as supported as possible, but also, sending a consistent message about the importance of attendance? If a kid's willing to engage with me and meet, it's going to be a slower burn type of work to kind of, in almost like a motivational interviewing type of way. Like, let's talk about what matters to you. Like, I get it that school's not motivating at all right now. So let's talk about, what that means, and, the pros and cons of that, and, where that leaves you. And I'm pretty transparent about, in the meantime, either I or a colleague will probably be working with mom and dad or grandma or school to kind of figure out the other parts of this. But that is a common presentation, and exactly why I think it's important to kind of leverage the other parts of the system.
Right. And there's another question that sort of came in as you were talking about, how do you figure out what the function is or what is driving the anxiety when the child can't talk about the anxiety or doesn't want help with it? Similar answer.
Yeah, no, similar answer. I mean, if you have a kid, if it's a kid who really is struggling to really talk about their anxiety or just doesn't want to really engage in the therapy process, which is pretty common. Again, it's working much more with parents and caregivers and family systems and school systems. If it's a kid who's at least willing to meet, um, then like I said, it's just a slower roll. It's like, building a relationship, getting a sense of like what does make them tick, what's, is there anything that's motivating? Can we tie in, there are any types of values down the road that we can tie in? But I'm not expecting that kid to make like a complete 180 in a few sessions and be ready to go and be like, hey, Tony, all right, let's do this thing. I'm putting my, I'm investing more in the, interventions with other folks to help them get moving.
Right. Related, I'm going to take another turn with this too, and go on a tangent. What happens if you come up with a plan for what home looks like if a child won't go to school, and that plan, either the parents or that the parents are having some type of difficulty making that plan come to fruition? For instance, if you stay home from school, you cannot be on your phone all day. And kid says, well, great, come and like wrestle it from me then. And you don't want to get into a wrestling match with your child. Suggestions around that.
And that's almost always the rule and not the exception, right? So if you get a case where you set up a plan with parents for what the home should look like and they're all good with it and kids all good with it, my goodness, you celebrate that, you take that to the bank, because that doesn't happen a whole lot. And this is why I say it's so important to be checking in, if not daily, then almost daily, with the whole system, because we're making adjustments all the time in terms of a plan. We're tweaking, we're modifying, we're to be totally honest, sometimes trial and erroring, like what's going to work. We are, sometimes I've had full sessions with parents about like, where do they have leverage? What do they feel is feasible? With younger kids, yeah, sure, we can remove electronic devices. That gets a whole lot harder when our kids are older. Also, with high schoolers, we're dealing with people who are adult size, right? And very often, not very often, but with some frequency, when we're setting limits with kids, they can get violent or threaten violence or threaten aggression. So you have to be really mindful about, if you're putting these things in place, how do you expect your child to react? And what is the plan if they do react in a way that feels aggressive or dangerous in some way? And is it worth it? And that's really a decision to happen with the clinical team. I'm almost always kind of consulting with psychiatrist colleagues or colleagues here to think through, where do we draw a line and where, what's worth it for this kid? Because on one hand, we don't want to create a situation that's kind of leading a kid to get a whole lot of distress, and certainly where it's unsafe. On the other hand, if those parents and caregivers don't set limits ever, that kid's going to be on a trajectory where they're really not learning how to manage any demands. And these are the kids who we really do see have a very, very hard time post high school, if not before then, and just puts them on a bad trajectory. So for those kids where a kid is saying, no, we're not going to do those limits, sometimes it is like helping parents kind of be tougher and firmer. If there's a risk concern, if there's like a violence concern, I will be very mindful of, is this worth it? If I deem it worth it, then I'm walking with caregivers very carefully about what are their contingencies to kind of maintain safety. Do we need to kind of have mobile crisis at the ready or something along those lines? Similarly, if you have a risk where a kid might kind of threaten suicidal, behavior if they're pushed in terms of having their phone removed or anything like that. Unfortunately, these situations happen in this work, and that's why I think it's important just to understand the system and understand the kid, and to work very closely with the family system with these situations. That said, a lot of times parents have fears of these things where there's not really like a founded reality to it. So I think as a clinician, what I'm always thinking is like, is this a true risk, or is this just a parent's concern and a fear that this bad thing might happen?
Thank you. There's so many more questions. We could have done this for another hour just with the questions alone. And maybe we will try to figure out a way to schedule some type of continued continuing education event, because clearly this is a topic that's really important to a lot of people, and that's really interesting to a lot of people, and that people have a ton of questions about. That said, it is 3:58, so we do have to close. There's been a bunch of people asking about slides. We will get slides for everybody. Also, again, this is recorded, so you can refer back to it on our YouTube channel as well. But I want to thank everybody for being here. Especially thank you, Dr. Puliafico, really amazing presentation. For those of you who are interested in more CE credits, our next one will be on November 9th with Silver Hill, where we will be addressing treatment-resistant schizophrenia in young adulthood, treatment strategies, and common barriers. So keep a lookout for that invitation as well on another important topic. Again, thank you all so much. Thank you for being so active in the chat. We really appreciate the dialogue.
Thank you all. This was terrific.
Thank you. Take care, everyone.